can definitely affect the exposure rate, them getting suffering from COVID more, etc. Another big issue is not having access to health insurance. And this could be because they can't afford it. Maybe it's not offered by an employer or because of their legal status. And kind of related to the first one, with no health insurance, some people don't feel comfortable going to the doctor because they don't want to rack up those medical bills, which could become another source of stress. And then this third one is about discrimination, and not discrimination in the way that we necessarily think about discrimination. So based on their race or ethnicity or other factor, but specifically that they don't want to be discriminated against for having COVID-19 and potentially losing their job or being pushed away by friends or family because, now they're positive. And unfortunately, we look at that in a negative way and treat people differently sometimes. Another big concern that came up was related to just information and resource access. So in the community, there's lots of misinformation and myths, some of which I'll share in a moment. And what we heard from the listening sessions was that some people in our community don't understand what it means to be asymptomatic. And as a result, they don't get tested, even if they are exposed to someone else that tested positive for COVID. Sometimes our community doesn't search for information because we're afraid that we won't get help. Sometimes there's just not enough information being translated into Spanish. And we heard from the community that they see a lack of creativity from organizations and how they convey messaging to the Latine community. And another issue is that not everyone is aware that there are COVID-19 testing options that come at no cost to the participant and are afraid of taking the test for fear of potentially taking on that medical bill. Another thing that came up a lot was not getting the resources they need. So this could relate to technology access or access to computers or Wi-Fi. And another kind of big one was that some people in our community don't qualify for public benefits, such as rental assistance, because they don't have a social security number. And if they do have kids that have a social security number, then sometimes they can access benefits that way, but they kind of have to proceed cautiously and consult with a lawyer if they can, because if they're in the process of obtaining residency, receiving public benefits could have an impact on that process. And then the third thing here is that some people in the community are not following regulations, is what we heard. Some of these maybe don't apply as much now as things have changed a lot over the past few months. But back when we had these conversations at the end of last year, participants shared that some people were not wearing masks or were not wearing them correctly. Some people were having parties or convenings or having, guests over instead of kind of remaining within their own household, or that people were just not following the regulations in general, maintaining 6 feet apart, things like that. Other concerns in the community, loss of jobs, hours, or income. So we heard that some people are afraid of losing their job because of getting sick with COVID. So having COVID caused them to lose their job. There's fewer opportunities, which is especially impactful for those that are undocumented because it makes it that much harder to find a job. And then was also concern about fewer hours at work, and as from a reduction of hours, similar to like losing a job, that having an impact on their ability to pay their bills. We also heard from community that sometimes employers take advantage of workers. And this has been an issue, especially with undocumented workers who maybe don't have the same legal protections as citizens or residents. And the participants shared that some employers have taken advantage of this fact and are paying undocumented employees a lower rate, and the workers feel like they can't do anything about it. And this is worrisome to them because like anyone, they worry about paying bills and may not have access to those public benefits that US citizens and residents have access to. We also heard from community feel that they sometimes feel like they have no choice but to work. So they shared that they feel like they have no choice but to work, and don't have sick time off many times. So they feel like they end up in a position where they have to choose between their own safety and then their financial situation. So do I go to work and potentially get some people sick, or do I not feed my family this week? A very difficult situation to be in. Some employers keep pushing for employees to work more, even if they are sick. That's something that came up. And like I shared earlier, there's that fear of being discriminated against for getting sick. So some people that are infected refuse to say they got it for fear of losing their job. The third point on here goes back to the undocumented workers. So something that came up during these conversations is that sometimes undocumented workers use a different name at work than their real name. And if they go get a COVID test, maybe the name on the COVID test doesn't match up with the name they have at work. And things can get a little bit complicated in that regard, because then the employer might start asking questions that that individual might not be ready to answer. And then the last set of challenges that I'll share here are around landlords, mental health, and online schools. So what we heard from community is that the landlords are not being very understanding and are wanting to kick people out because the renters aren't able to pay their rent. And like I shared, some people in our community are not eligible for public benefits. We heard that the mental health of the community has suffered, as it has in many different communities, and that just in general, feelings of anxiety and depression has increased. And then the last thing is that online school has just not been an ideal situation for a lot of kids. Some parents have to go to work during the day, and as a result, they can't be sure that the children are connected, especially for the younger kids. And again, this might not be applicable as much now, but this was the case a few months ago. And for the parents that do have to go out to work, they can't necessarily follow up with their children, and they feel like that's affecting their kids' performance in school, especially for kids that have special needs. So here are some of the myths about COVID-19 in the community. So we're not labeling these as myths. So we asked in the listening session, what are some myths you've heard? And these are kind of the major things that came up. So the first one was that COVID-19 is a lie. So they've heard, that it's just a flu or the cold, that it's type of pneumonia, or that we've had COVID-19 in the past. The second one is that COVID is a form of population control created by the government. So some people believe that Latinos will be the last to get vaccinated because the government doesn't care about us. And then on the other end, some think that Latinos will be the first to get vaccinated to make us the test subjects. So you can imagine, what some people might be thinking about that could potentially be influencing the vaccine hesitancy that we're seeing now. Related to population control, some people shared that they've heard that COVID is fake and that the government created it to get rid of immigrants, or that there's too many people in the country and that there's a certain amount of people that need to die, which is led by a secret group that's above and more powerful than the US president. The next one is COVID is a political tactic. Some say that it's politically oriented to cover, and that it was created to cover something that was wrong. And for Latinx, this feels more like an economic conspiracy and maybe not necessarily as political in the way that some white Americans might think about this situation. Another myth, hospitals are inflating COVID-19 deaths. So they're hearing that all deaths are being marked as COVID, even if the cause of death is really something else, like cancer or heart disease. They've heard that that the government is giving hospitals money for every person that dies of COVID. So the hospitals are saying that people are dying of it, even though that's not the real cause of death. Another myth, COVID tests cannot be trusted. And they've heard this because sometimes people get the COVID test and they test positive, but then they can also test negative. So there's a little bit of mistrust there. And even for some people, even if they believe in COVID, maybe they don't necessarily believe in the vaccine. And then the last kind of major myth here is that once you get COVID once, you can't get it again. So something that was shared in the listening sessions was that they've heard that the person who gets COVID and passes it on to someone else can't become reinfected. And that if they pass it on to a family member, then that person becomes immune to it. So that's kind of the part of the reason why they just kind of go out and about and spend time with others and not really thinking about whether others can be infected. And then they've also shared that they've heard that the vaccine brings a microchip to monitor people and that it can also modify people's DNA. So a lot of our work lately has been, around education and combating these myths because they can be very, very damaging, even if some of them sound really out there. I know we're running short on time, so I'm going to somewhat speed through these next slides, but I just wanted to quickly share some data on our COVID-19 hotline and our reach. So this is, as Rodolfo said, through the COVID-19 Community Coordinators Program, or CCC. And you can see here that as of last week, a little over half of our callers are first-time callers. The majority of the calls are being conducted in Spanish, and a little over 3/4 of our callers identify as Latine. So currently we have 3 hotline specialists who take the calls, and they're bilingual and bicultural. So we promote primarily to the Spanish-speaking community, but we offer that service in English or Spanish, depending on the need of the individual. About half of the callers are Mexican born and almost, not Mexican born, but have Mexican ancestry. And almost 2/3 identify as immigrants born outside of the US. Of the services requested, a large portion fall under the category of food, shelter, or medicine. And in the category other supports, there's just various miscellaneous things like legal assistance, where to find clothing. Over the winter, we had people calling, asking where they could get free donated toys for their kids. So various things like that. And then this last section, I'll quickly share some of the strategies that have worked for us for engaging the Latine community. So a few things that we've done is that we've hosted informative listening sessions over Zoom to get insight into some of the major needs in our communities during COVID-19, which informed a lot of what I shared in this presentation. We brought some experts on Facebook Live. We have a campaign called Info Martes, or Talk Tuesday, in which we host experts in various areas on Facebook Live to share important information on different resources available, offer COVID-19 education, and answer questions. And then we have 3 public health coordinators that conduct outreach for this program, and they've been doing a lot of networking virtually, but sometimes they do go and drop off masks and flyers at different grocery stores or community organizations. And they also go to COVID testing events offered by the state and offer a language support. When it comes to conveying messaging, I think really the 2 main things are deliver content and information in Spanish and offer it in different formats. So, we get the question a lot of, what's the best format to reach the Latine community? And I think for this one, the answer really is to use as many diverse strategies as we can, because some people love Facebook and Instagram. Some people like to get their information from the radio, some from the TV. And we've invested in all those types, and you'll reach a different segment of the population through each method. So just focusing on one thing, like social media, for example, isn't going to cut it. And it's also important too, as you're thinking about these media types, having different both visual and audio options, because people in our community do have different literacy needs. And then this last slide, when it comes to delivering services, I'll mention it again, offering services in Spanish. It sounds a little bit obvious, but I meet people that say they're struggling to reach the Latine population, but then they say they don't have a Spanish speaker on staff or haven't translated their materials. And that's very important if you want to reach our community. Otherwise, the information isn't going to be accessible. The next thing, build trust with the community. So that means being visible and interacting at different touch points by partnering with other organizations, attending community events once it's safe to do so, etc. And then the last thing is being mindful of collecting data that is necessary versus nice to know. So something around immigration status, for example, or other private data like an address. Some people in our community really don't feel comfortable sharing some of that, more than a name or phone number. So it's always important to adapt to that. And as an evaluator, sometimes there's things that I want to know because I think it would be, interesting, but I have to be really intentional and think through about how I'm going to use the data I'm collecting. So if I can't tie a specific action or strategy to the questions I want to ask, then I rethink about whether I should be asking those questions at all. But that's all I have for you. Apologies for speeding through it, but we welcome any questions you have at this time, and thank you for the opportunity to present.
Thank you so much, Carolina. We have two questions that were put in the chat. The first one was, do these results apply to all Latine communities in Minnesota, including rural versus urban communities and migrant farm workers? If so, were the differences among the populations?
Are you for the person that asked the question, is it referring to like the MDH data or our hotline data?
Yeah, I was the one who asked that question.
Yeah.
And so I work for the Upper Midwest Agricultural Safety and Health Center. And so we focus on individuals who work as farm workers in the agricultural industry. And so I just know that there's, the Latine community is very, very diverse in identities and in regions and in occupations. So I was really referring to that first half of the presentation.
Yeah, I would say, yeah, there's certainly some variation. Some of the public data I looked at, I didn't necessarily look too deeply in terms of greater Minnesota versus the metro, but from what we've seen so far, we're supporting some vaccine events like Rodolfo said, and we are feeling like there's good, at least some of the vaccination rates in the metro area are looking better and improving, but we're not seeing the same rates of vaccination in greater Minnesota. So one of the strategies that we're looking into are whether we can support in vaccine events in greater Minnesota with actually farm workers and agricultural workers, among other groups, so that those individuals have access to the vaccine. Rodolfo, do you want to add anything?
Yeah, I would like to say just that, yeah, that is a wonderful question because we do have so many differences that have to be noticed. Like, for example, so many people are really not willing to participate in testing sites because they want to avoid putting on risk their own employment, because if their employer knows that they are being tested, they might be suspicious of carrying over the COVID-19, and then they are gonna be removed from their positions. So that is a very high risk, particularly among those who are in the meatpacking industry or agricultural workers. But also we are now trying to reach out all those agricultural workers who are seasonal workers in Minnesota, and they are very hard to reach. And they are different. They are coming from Texas, they are coming from California, they are coming from other states, and many of them are already carrying a first doses of vaccine, and they are only needing 2. So we don't know yet how we are going to be dealing with that. But yeah, they are different, and the difference are really clear between rural, urban, and even depending on the area of Minnesota they are working or living in. Thank you for that question, Maria.
And there's one more question. I don't know how much time we have. We're going to be out at 3:41, but the other one, if we can get to it, have you seen caller demographics change over time, or are their recent demographics pretty consistent with the ones you started the hotline with?
I would say they've been pretty consistent. The thing that's changed the most is probably what people are asking for. So whether it's like vaccine registration versus, once the rental assistance programs were open at the end of last year, those drew a lot of calls to the hotline and things like that. So I think what people are calling for has changed, but not necessarily too much the age or the race, ethnicity, or anything about